Yeah, good morning and welcome. Today we are at a good farm and we're here to just do a quick um, overlook or take a quick oversight on the activities on the farm. Quickly, I just want to tell you about some of the things you have to pay attention to, especially when you are interested in doing this full scale. The first thing we do as veterinarians or as health professionals is that, for ruminants that graze, by grazing I mean eating from the ground, like eating grasses, eating food from the ground. They are the first common problem that all ruminants have is this worm infestation, and that's what we pay keen attention to. By worm infestation, I mean, they have problems with helminths or worms. Worms, yeah, worms particularly. So for worm infestation, for adults, what we do here, we do a routine deworming for the adults, and that we do once every 4 weeks. The reason is because they are grazing, the shelf life of these worms, it takes about 3 to 14 days for a worm to move from the egg to the adult stage. So instead of leaving it to chance or giving your animals, maybe leaving them for 2 months before deworming them, I would advise you do that every month, especially when you are not doing exclusive concentrate, when they have access to grasses. Then for the young ones, especially when they are less than 6 months of age, we do our deworming every 2 weeks. That way you're able to, break the cycle of this worm's proliferation and you have a healthy flock. Yeah, so currently we are here to take care of these young animals. Most of them you see here, they are less than 4 months old. And like I told you, we're here to do our routine. We give them multivitamins, we deworm them, and we check them to be sure that there are no enteric parasites or hemoparasites. Come and let me tell you how we do this. We'll catch any of them. So come. Okay, so when you see an animal like this is how we do our routine checks. Before you medicate, you look at the animal. First of all, you look at the mucous membrane. Okay, you can see that it's pinkish. Can you see this? So there's no discharge from the eyes. There's no water from the eyes. There's no discharge from the nostrils. And you check the mouth for signs of any viral infection. Then you check the lymph nodes. There are no swollen lymph nodes. Then I check the skin. Are there any ectoparasites? I want to see. So this animal is clear. You can see with this, you can say yes, this animal is healthy. Why? Because the mucous membrane is telling you that there's enough blood, in the system, and the fact that I can't palpate any swollen lymph node means there are no ongoing infections. So all I'm doing is I'm giving prophylaxis, especially because for the past 3 days now it's been raining, so I just want to cover them from cold and make sure that they do not have pneumonia. So this is actually a dewormer. The worms that we're trying to target is this homunculus worm. I'll show you a video on those different kinds of worms later. This. This is equally another dewormer, but I'm trying to target tapeworms and roundworms with this. So yeah, now I want to talk about how to give oral medications. A lot of people make mistakes when they want to give oral medications, especially to young animals like this. How do I mean? They try to hold their mouth, they try to make sure they force a large volume of fluid down the throat. And as a result, a lot of complications can come out from this. Example is what we as doctors call aspiration pneumonia. And it has killed a lot of animals. Why? Because in an attempt to, you of a farm handler or an overzealous farm attendant trying to, give aid to an animal that is struggling or trying to provide care for an animal that is struggling, you tend to complicate the situation by putting fluid instead of going into the stomach through the esophagus. You push it down through the trachea and it clogs the lungs. And instead of the animal being able to breathe, drowns, based on the number of fluid you've given. So please come, let me show you how to do this, and so that you don't have that kind of complication. So when you want to give a young animal like this, especially after you've collected the fluid, I would prefer that you use a syringe. It might not be as small as this. You can use something bigger, just something that has an aperture, an opening like this. Now there is a fluid here, or a what do we call it? A syrup here that I want to give to this animal. Instead of just holding the animal like this, some of them would instead of trying to hold the animal like this, I would use this commissure, this opening at the back of the mouth here. Just make sure you restrain the head very well, and you put it at this side. You can see it's hooked here. The animal cannot shift like this, and you press gently. If you see, the animal is drinking without stress. It's not like I'm gagging the animal. I'm not doing this. I'm not doing this. I'm not trying to force it down the throat. I'm doing this instead. You can see it's the swallowing reflex is not hampered, and when you do this, you are sure that yes, the animals will not come down with pneumonia or die from you trying to assist them or force feed them. I hope that helps. When you see things like this on your pen, you see that the feces is becoming mushy. Please focus on that feces. It has gone from this state. Look at the state. This is normal. That is not. So when it has gone from individual droplets like this, or individual forms like this, you have to pay attention to gastrointestinal parasites, and that's what we are doing. We are making sure that they remain all year round in this state, so that they're able to convert the feed that we give them, and they're in perfect health condition. So when you have this kind of physics, you'll be suspecting gastrointestinal parasites, especially coccidiosis in ruminants. So that's the importance of coming over to check. So when you do routine checks like this, you're able to detect it early before it becomes bad or the animal becomes dehydrated from the loss of electrolytes. You're able to give the necessary medications and the electrolytes, and you have a healthy feed. Yeah, so this is one of the reasons why your animals are not gaining weight. You might ask why or how. The reason is simple. This is a nutrient block, or what we farmers know as mineral block. It is high in salt content, and multivitamins. And why is it essential? It's essential because for animals that are based on grasses alone, it's important you provide sodium. Sodium, salt is sodium chloride, but that sodium component, in salt is what is responsible for, the microbes in your stomach to be able to convert the grasses to, usable nutrients that these animals can use. So when you are feeding your animals grasses and they are deficient in sodium, the grasses that they are eating, although their stomach can be big, but it cannot be translated to proteins or vital nutrients that these animals will be able to use. If you look at this place, you see that there's a difference between what you are seeing here. You can see there is a lot of work going on here that is not good for the health of this flock compared to this place. Come. You can see that this place is cleaner. Why is it cleaner? It's because there's a particular amount of spacing that is required when you are constructing a holding area for sheep and goats, and these spaces that we allow between each of these slabs that we've created allows for feces and urine to go down and not remain on the floor. If you look at this place, for example, you can see that this place is clean. The animals have less contact with their feces and their urine, but this, please focus on this. This, is marshy. The feces is still retained on top of this place, and this is a very good breeding ground for diseases, for both gastrointestinal parasites, gastrointestinal bacteria, and all of those diseases that plagues your flock. So whenever you are constructing a holding area like this, yes, when you are putting the slabs, it's important to make sure that the spaces are not so much, so that fractures will not, emanate from there. But you need those spaces to allow easy flow of feces that is being defecated and urine to, to not be lodging around where the animals are kept. Why do we make sure that we have partitions like this? These partitions makes, it possible for you not to overcrowd them, or for them not to be overcrowded at a point. As you can see that they are evenly distributed, and they are not competing for food or for water or for space. And with this, you are able to get the right weight, and you're able to prevent disease spread from animal to animal. So during the cold, when it's raining, or when there's a lot of cold, you know, there's a modification for them to be kept, to be shielded from the rain and from cold. This helps us to, at least to a large extent, regulate the temperature within the room, and this has helped us to reduce, the incidence of pneumonia on this one. So can you see the environment? This is the wonderful handler, and you can see the ground is very clean. There are no fecal material. All the feces that they pack from here, we take it outside the fence, and that way we reduce the incidence of disease. Okay, so please don't forget to share, like, and subscribe, especially if you found this helpful. Thank you.